All right, Dr. Pete here. I want to talk to you about the healing power of fasting and how we have to stop as a society and as patients getting in the way of that process. Now, in 2024, we have fancy terms like intermittent fasting, time-restricted eating, etc. And I sit here before you to say that we should practice these techniques. But for millions of years, before we could articulate these techniques or these programs, your body simply sent a signal to you to fast, and that signal was nausea. Now, no one likes being nauseous, but that is oftentimes a necessary evil. Nausea is your body's signal to fast, and fasting can heal you. Embrace nausea and fast. Stop masking that sensation and delaying your ability to heal. When someone has a surgical abdomen, they don't want to eat. They have nausea. When someone eats something they're allergic to or intolerant to, they get nausea. Nausea is a signal that something is to be treated or avoided. And nausea leads to fasting and thus healing through a multitude of beneficial pathways. Embrace the nausea. Embrace fasting. But our society doesn't like discomfort. Sometimes we'll even prolong illness just to avoid the discomfort of the healing process, which is ironic. Now, of course, in extreme situations, nausea can lead to dehydration, and we don't want that, but oftentimes my patients in the ED are not dehydrated at all. They just want to go back to eating Taco Bell and McDonald's as soon as possible. In fact, many of them actually have bags of that stuff at bedside. So I want to go a little deeper, or press this theme a little bit longer. Parents get worried about their child not eating. This is the wrong interpretation. They should be worried that their child is sick. Not eating is the cure. Parents obsess about medications to eliminate nausea so they can see little Johnny eat again. But nausea is not the root cause. There's often a virus or a surgical problem to address first, so stop worrying about the lack of food intake. An analogy. It would be like saying, I don't ever want to see a plumber because I notice my plumbing is always broken when he's around. Guys, the plumber shows up when there is a plumbing problem. Let the man do his work and take care of the issue. Savvy? The point is that if your body's telling you that you're nauseous, it probably means that there's a problem. It's probably trying to convince you to fast so all of those physiological and metabolic pathways can be turned on and so that you can finally heal. Now, just on a very practical level, if I'm talking about how nausea, generally speaking, is to be embraced and fasting to be embraced, then when should you be worried about dehydration? And on a practical level, every person should be able to urinate at least once every 8 hours. If you have nausea, you notice you're not urinating, now it's time to worry about nausea, and you can come see me in the ED and we'll take care of you. Okay? But nausea leads to fasting, and fasting is a healing technique and method we've been using for millions of years. And getting upset that you're nauseous is like getting upset that the cure is in process. And we should recalibrate our sense of where the problem is and what the true problem is underneath it all.